So once I go into my patient's chart, I want to find out how to put an order into the computer. On the left side of the menu right here, from the all the options, we're going to just choose order. And this would be true whether it be all orders or medication orders. Right now we're going to focus on medication orders. So I'm going to choose new order. It's going to bring me to this screen right here. I would start typing the first three letters of whatever it is that I want to put in there. So I'm going to put furosemide. Now it's telling me the different options that are available. There is an arrow on the right side of the screen that you can't see right now that I can actually move, and it'll tell me all the different things that are available. All right. So if I don't see what I want, I pick the thing that is the closest to it. So I'm going to pick furosemide that is a concentration of 10 milligrams per ml. It's a written order, and it was by Dr. Schmorka, so I'm good. But now I'm going to actually scroll down, and it's going to give me the option to change the dosing. So there's my name of my drug, telling me it's furosemide available in 10 milligrams per ml, but maybe I need to give 30 milligrams, right? Doesn't generally come in 30 milligrams, so we have to alter what is available. So I put 30, and now I'm going to type mg. Now I have to pick a route. Remember, it's an injectable, so the correct route would be intravenous. So I'm going to just type IV in the box. And then if you just type, it will give you all the options that are available. And then the frequency would be, I'm going to say every 24 hours, which is the same as saying every day. Depending on where you work, they'll use different terminology. Sometimes they'll say daily, sometimes they'll say every 24 hours. So you just have to find out what it is that they're doing where you work. So now I'm done, right? I have my dose, I have my frequency, and I have my route and my name of my drug. So I'm going to come back up here and I'm going to hit sign. If there's an error, it's going to tell you what the error is. So that order is now moved down here into the current order section. So you can see it, that I altered this at 11:22. It's furosemide, 30 milligrams every 24 hours by the IV route. And down here it says it's going to be dispensed by the pharmacy as 10 milligrams per 10 ml. So then I would have to do math for meds to figure out how many mLs am I going to give. If I wanted to edit it, perhaps I wanted to change something or I forgot something, I could go over here to this edit button, and it's going to bring me right back to that screen I was working on before as it was ordered. But maybe my instructor wants to know what the patient is taking this for and what is the classification of this medication. So I'm going to write here diuretic, and my patient is taking it for hypertension. That's going to be a challenge for you to try to figure out what the patient is taking the medications for. Something like furosemide can be given for congestive heart failure. It could be given for the crackles associated with congestive heart failure. It could be given for edema. It can be given for high blood pressure. So the patient may know why they're taking their medication. The patient may not know why they're taking their medication. So you have to go through the patient's chart. Remember to always read the history and physical. That's what brought the patient in the door. And then a couple days later now, your patient's in the hospital, you want to be looking at the progress notes to see why they're still here, especially if they change the medications. So Then when I'm done with the changes that I've made, I have to remember to go back up or down as the case may be and save it or sign it. All orders put in by a nurse are always co-signed by a physician, generally within 24 hours, because it is outside of our scope of practice to actually write orders, but we write them on behalf of someone else. Some orders are protocols, so they are put in automatically, and some are, say you call the doctor at home and he says to you, well, my cable's out right now, I can't put the order in myself, so I need you to put it in for me. So that's when you have to remember that you have to have a name of a drug, a dose, a frequency, and a route. And you certainly need to understand why the patient is getting the medications. All right, so if we come back down now, we're going to see that those changes that we made are going to be here. It's a diuretic. My patient is taking it for hypertension. So that's like a communication tool with your instructor, letting them know that you understand why the drug is given. You never want to give a medication to a patient that you don't know why they're taking it. All right. If you have any questions, you can either ask your pharm instructor or your clinical instructor. All right. Have a great day.